Motion on NHS Dentistry. Peter Aldous to move.
Thank you very much, Madam Deputy Speaker. I thank the Backbench Business Committee for granting this debate, and I also thank the Honourable Member for Bradford South for her work in helping secure it. I beg to move the motion that this House is concerned by the growing crisis in NHS dentistry, notes that 9 out of 10 dental practices in England do not accept new NHS patients, regrets the number of dentists moving away from NHS practice, welcomes the government's commitment to levelling up health outcomes and dental health across the country, calls on the government to take urgent steps to improve retention of NHS dentists and dental accessibility for patients, and further calls on the government to report to the House on its progress on the steps that it has taken to address the NHS dentistry crisis in 3 months' time. I also highlight petition number 564154, signed by 11,067 people, calling for an independent review of the NHS dental contract. Madam Deputy Speaker, colleagues have been securing debates on the state of NHS dentistry for the past 2 years. This crisis has been brewing for a long time, and the situation can be likened to a house built on shallow and poor foundations, which has come crashing down with the earthquake of COVID. The King's Fund describe NHS dentistry as being on life support, whilst the British Dental Association describe it as undergoing a slow death. In their monthly report for October, Healthwatch repeat that NHS dental care continues to be one of the main issues that they hear about from the public, who across the country are clamouring for NHS dentistry which is both affordable and accessible. In Suffolk, there are 70 dental practices with NHS contracts. Not one is taking on new patients. Locally, there has been some welcome support, in that in Lowestoft, a local practice was granted additional units of dental activity that allowed them to see emergency patients until the end of September. And in July, the Dental Design Studio were awarded a contract to deliver NHS dentistry for up to 8 years. However, very quickly, both practices were fully booked up and have had to turn away patients. Madam Deputy Speaker, there is a need for root and branch reform, and I shall now briefly set out those issues that need to be included in a blueprint plan for NHS dentistry. I give way to my honourable friend.
I'm very grateful to my honourable friend and congratulate him on this debate. Would he agree with me that the fundamental problem with NHS dentistry at the moment is the 2006 contract and the units of dental activity? Does he share my disappointment at the statement made in the summer about how to resolve the situation based upon the consultation launched last year? And does he furthermore hope that UDAs will be expunged from all of this so that dentists can be properly rewarded for the job they do and thus return to the NHS?
I thank my honourable friend for that intervention. I agree wholeheartedly with him on that point, and I will come to it as I set out what I believe needs to be done to improve the situation, and I think that he and I are very much on the same page on that particular issue. I will address firstly, Madam Deputy Speaker, the issue of funding. There is a need to secure a long-term funding stream. In recent years, the NHS dental budget has not kept up with inflation and population growth. Since 2008, NHS dentistry has faced cuts with no parallel elsewhere in the NHS, and the British Dental Association state that it will take £880 million per annum to restore the service to 2010 levels. I acknowledge the budgetary challenges that the Chancellor faces, but the reform process is doomed from the start without an appropriate level of investment. There is a need for a protected budget, and any funding that is clawed back must be kept in dentistry. Secondly, a strategic approach should be adopted towards recruitment and retention, with a detailed workforce plan being put in place. I'll give way.
Very grateful to him for giving way, and congratulate him and my honourable friend from Bradford South on securing this debate. It is a crisis. It's a crisis in South Manchester, as it is across the country trying to access NHS dentists. Now, there are highly trained dentists from abroad who can help. I've got some constituents who are trained at the dental faculty of the University of Hong Kong, which is in the top 3 faculties in the world, has an English curriculum, but they can't get registered, they can't access the licence exams. Now, I understand the government have said they're going to simplify the registration process. Would he join me in urging the government to act very quickly to make that happen?
I thank the honourable gentleman for his intervention there. He's come in at a very appropriate time, and he may well have been reading my speech, because that actually was the very next point I was going to come on to. What I was going to say is, in the short term, we need to be stepping up recruitment from abroad. Whilst the legislation tabled earlier this month to streamline the process of recognising overseas qualifications is welcome, this on its own will not address the problem, and I hope the Minister in his response will address this particular issue. In the longer term, we need to be improving dentistry training ourselves and ensuring that this is available throughout the country. And in this regard, the proposals being worked up by the University of East Anglia and the University of Suffolk are to be welcomed. Madam Deputy Speaker, thirdly, there is a need for a new NHS dental contract, as my honourable friend mentioned a minute or so ago. It is welcome that discussions have started on revising the contract, but there is a worry that the government are only looking at marginal changes when ultimately a completely new contract is required. At present, the NHS contract is driving dentists away from doing NHS work. Its target-based approach is soul-destroying for so many, and it needs to be replaced by an agreement that has prevention at its core. And Madam Deputy Speaker, that leads me on to the fourth and penultimate component of a new system of NHS dentistry: the public promotion of the importance of good oral health and looking after our teeth from the cradle to the grave. Denplan proposed that the government and the NHS should lead a public education campaign to emphasise the importance of oral health. There should be provision in the aforementioned new contract for dentists to go into schools, as well as into care and nursing homes. When economic conditions allow, let's be imaginative and exempt children's toothbrushes and toothpaste from VAT. This can embed good oral health care at an early stage of life. It is welcome that the Health and Care Act facilitates the rollout of water fluoridation projects, and the government should proactively work with water companies to ensure that this is universal. Finally, Madam Deputy Speaker, there is a need for clear transparency and full local accountability for overseeing and commissioning NHS dentistry services. I acknowledge the hard work and great effort of those working at NHS England, but we do need to replace a system that is inaccessible, opaque, and confusing. The Health and Care Act provides us with the means of doing this, and it is welcome that as from next April, many integrated care systems will be taking on responsibility for local NHS dentistry. This is the right approach, as good oral health care is essential for good general health and well-being, and it's inextricably linked to primary, mental and emergency care. It is vital that those involved in dentistry are represented on integrated care boards. Madam Deputy Speaker, across the country, there are a multitude of dental deserts. If we do nothing, if we apply the odd sticking plaster here and there, they will turn into one large Sahara. We owe it to those that we represent to ensure that this does not happen. This means that we need, as a matter of urgency, that blueprint plan for new NHS dentistry. It won't be delivered in one fell swoop, but we need to clearly lay down the route path and start taking meaningful strides down it. It is with this in mind that the motion calls on the government to embark on this journey and to report back on its progress in doing so in 3 months' time.
The question is, as on the